Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. My name is Salman Khan. I'm a laboratory technician by the profession. Today, I'm going to talk about the recent pandemic issue, that is the coronavirus, that is also known as the SARS-CoV-2. We will talk a little about what is SARS-CoV-2, what is its symptoms, the WHO declaration, the chronic implications caused by the coronavirus, its incubation period, its different therapies, or the different ways of treatment that could be beneficial in SARS coronavirus infection disease. So first we will talk about what is the SARS and the COVID. So SARS is basically is the severe acute respiratory syndrome, and the COVID means the coronavirus infectious disease. So if we will talk about the coronavirus infectious disease, that whether it's a new discovery, a new virus, or it belongs to an old family, so I will tell you that coronavirus is not a new virus. It has the two different types, that is known as the Middle East respiratory syndrome and the SARS-CoV-2, that is denoted as the SARS-CoV-1, and the pandemic issue in 2019 that begins in the Wuhan, China, that is known as the SARS-CoV-2. So it's a coronavirus and it belongs to an old family. So if we talk about the symptoms of coronavirus, so the basic symptoms of coronavirus are fever, that is the flu-like symptoms, dry cough, fatigue, and when it gives some excessiveness, so it causes shortness of breath. So these are the different symptoms according to the WHO, and the WHO declared it as in a pandemic issue in March 11, 2020, which we all know, and they really defined some limitation for the trade and transportations, that is the flights, the trade among the countries, etc. So if we will limit the number of patients, the number of mortality rate will be decreased, and the healthcare provider will be sufficient for the patient quantity. But if we will have a maximum number of patient, a huge number of patients, so then we will have a limitation in providing the ventilator, the oxygen, the healthcare provider, and different economic problem, etc. So it's a very good decision by the WHO, and we all have to follow that rules, that is whether washing our hands with soap and sanitizer, and the social distancing, that is around about the 6 feet more, to avoid yourself from the gathered areas, to travel a lot without any necessary, and these are the preventive steps that are declared by the WHO, which we all know about that very clearly, and hope that everyone will take action about that, and they will implement that in their family, friends, and among all individuals, to save their life, to save their family, friends, and their self. So what if we talk about the chronic complications caused by the coronavirus, that is a respiratory failure, in which a respiratory system that work as an inspiration and expiration mechanism, that fails, and acidosis or alkalosis, that is something related to the pH that occur, and it can cause the death or organ failure, which we all know about that. And then there is an option of multi-organ failure. Okay, if there is ischemia in different organs like the heart, kidneys, or other organs, if there is acidosis in the blood or alkalosis in the blood, it will definitely affect the multi-organs, and it will cause multi-organ failure. Number third, that is a serious complication caused by the coronavirus, is the hypotensive shock. Now if we talk about the virus that persists on different regions, that is on the paper, on steel, on the aluminium, or the wood, that is different, and we broadly we say that it can stay is infectious state up to 3 to 4 days. So it's the summation about all the regions. It can vary according to regions, whether it is on the paper, whether it is on the wood or steel, but if broadly we say it, so we can say that 3 to 4 days. After that, we talk about the incubation period of coronavirus. So it is about 2 to 14 days. maximally the symptoms begin in these 2 to 14 days. And we all have heard that the quarantine, so basically the quarantine is passing the incubation period of coronavirus in isolation. So if the symptoms begin in these 14 days, so means he has some infections like coronavirus, and he should be, and if the symptoms got worse, then refer to the isolation ward. And if intensive health default occur, then intensive healthcare unit. If we talk about the therapy or the treatment of coronavirus, so no confirmed antiviral therapy yet, no vaccine still developed. Still they are thinking about the passive acquired immunity technique, that is the insertion of repaired colonial antibodies in the recipient blood, whether it will be intravenous or intragluteal, it will be discussed later, but they have that option, and that option has also used in the condition of Ebola virus, and that were so effective in Africa that really decreased the mortality rate. Recently the WHO talks about that the 6 vaccines are basically under development, and the America University claimed that they will prepare a vaccine for the coronavirus very soon. They declared the month also, that is the September. So hope that the vaccine will develop soon. But now we have to isolate ourselves, we have to isolate our family, the social distancing, the washing hands, or the different that is the techniques or the preventive measures that are described by the WHO. We should implement that on ourselves, on our families, in order to save ourselves from that pandemic issue of coronavirus. Thanks a lot for hearing. If any questions are there according to this lecture, that is the complication, because it was summarized by me, that is to convert more knowledge in few minutes or few seconds. So hope you will like that, and give me your feedback in comments. I will make some more videos for you and on the different topics. If you have any question according to the coronavirus, you can share it with me. Inshallah, I will search that deeply and I will provide my best answer. Thank you.